Greetings, ladies and gentlemen. I am Yolanda Richardson, Vice President of the International Programs for the Campaign for Tobacco-Free Kids. I'm speaking to you from Washington, D.C., and I regret that I could not join you in person for this event, but I'm honored to have the opportunity to address you on behalf of my organization and colleagues, some of whom are with you this evening. It is my distinct honor to address a gathering that includes honorable guests, the Secretary General of the East African Community, the Chair of the East African Community Council of Health Ministers, and Health Ministers of East African nations, members of the EAC Legislative Assembly, parliamentarians from East African nations, representatives of the World Health Organizations, and hundreds of distinguished public health professionals, academics, policymakers, scientists, researchers, and civil society representatives, all gathered here to discuss solutions to an impending public health crisis for Africa. The crisis is the rising tobacco use, particularly among young people in Africa. The good news is that the solutions to defeat the crisis are well known. All that is needed is our individual and collective resolve. The Campaign for Tobacco-Free Kids has worked in the United States to reduce tobacco use, and our president, Matt Myers, played a key role in holding big tobacco companies accountable for their lies, resulting in the historic Master Settlement Agreement. More recently, the campaign has also been privileged to provide support for tobacco efforts around the world. We've worked in every region, focusing on high prevalence countries, and now, with support from the Bloomberg Initiative and the Bill and Melinda Gates Foundation, we're focusing our efforts on Africa. As you know, rising rates of tobacco use in East Africa and the rest of Africa present a unique challenge. While rates of use are low relative to much of the world, they are indeed rising. We know that tobacco companies are investing heavily in getting Africans addicted to their products, and that there is certainty that tobacco-related diseases such as cancer, heart disease, and lung disease will compound the burden Africa is already feeling from communicable diseases like malaria, tuberculosis, and HIV. Now is the time to combine the political will of dedicated policymakers, the strong voices of civil society groups, and the expertise of public health professionals to address the tobacco crisis in East Africa before it grows in magnitude. We do not need to wait until death and disease from tobacco use further cripples already weak health sector, weakens the communities that we live in, and leaves the region with more untimely death. We can act now. Even as we contemplate the specter of this threat to Africa's people and the prosperity of its nations, East African countries are taking action. Kenya has already put in place strong tobacco control legislation, and other countries, including Rwanda and Uganda, are moving forward as well. It is my sincere hope that this meeting will serve as a catalyst for greater action and that we will soon see movement on tobacco control policies in every East African nation. As we have seen in other regions, such as Latin America, when neighboring countries act together, they build a stronger front against the tobacco industry. The solutions to the tobacco epidemic are supported by ample evidence of their success. Policies for large graphic health warnings, bans on smoking in public places, prohibitions against tobacco advertising and marketing, and increases in tobacco taxes are known to reduce tobacco use, especially when they are implemented as a package. It is my hope that these solutions will form the core of your action plans as you move forward from this conference. As signatories to the Framework Convention on Tobacco Control, countries have already committed to this, but greater action is needed. Of course, as you move forward, you will encounter clever arguments from the tobacco industry and its front groups about why these policies will not work. Quite simply, they're lying, because to implement strong tobacco control policy threatens their profits. With a distinguished group like this combining your respective influence, expertise, and passion, I'm optimistic that this conference will greatly contribute to the momentum for tobacco control we already see building in East Africa, despite tobacco industry opposition. As you progress in your discussions, I invite you to speak with our Director of Africa Programs, Joshua Trollo, about how the campaign can be most helpful to you. In closing, let me emphasize how profoundly honored the Campaign for Tobacco-Free Kids is to host this event with the EAC Secretary General, Dr. Richard Sazabera, and with the EAC Council of Health Ministers Chairperson, Dr. Christine Odona. We would like to thank the EAC Secretariat and the World Health Organization for their goodwill and collaboration in organizing the conference. I wish all of you a pleasant dinner, wish that I could be there with you, and look forward to our ongoing collaboration. Thank you.